physical therapists, other rehab professionals have also been looking into it, because then it helps them to allow people, endurance athletes and other athletes, to be able to train and to keep their conditioning levels up without injuring themselves. So as part of this, when this merger was, we've actually been looking into an Alter G for about 4 or 5 years. They're not cheap. So, you know, when you're a small private practice, it's hard to bite that bullet, and they have different levels. They also utilize them in a lot of the professional sports teams now have them. So with us being partners with the Land Sharks, I thought it was just a great thing to introduce to you guys, because we've already had several Land Sharks and endurance athletes coming through. I've obviously worked with endurance athletes for years, and I've always been looking for ways to help them recover and run without just limiting their mileage and things like that, the way I've been doing in the past. I mean, it's been effective, but this can up that substantially. So basically what it does, it takes the differential air pressure, that creates the seal, okay? And it's using air pressure to help offload your body weight. So when you get on the treadmill, when she gets in this and gets zipped in, now you have a seal, airtight seal, okay? The machine will then calibrate her weight, okay? And then once she calibrates her weight, we'll be able to take body weight off of her to a level that's sufficient for her. Now, once we do that, we try to get them training. If they're under some kind of precautions that we mandated or a physician mandated, we can easily go to that. So say you had a hip labral tear, okay, labrum tear, and you had that repaired. When you come in, you may only be able to go 50-60% weight bearing. This allows me to get you on something like a treadmill, get you walking with normal gait mechanics, and not compromise the tissue. Okay? The other thing that they've been doing research on, and there's been some recent studies that have come out, your metabolic activity, even with 20% of your body weight off, is the same. So if you're wanting to do recovery runs, and you don't want to put in the miles, which I've been preaching to the Land Sharks for years, that they're putting too much miles on their bodies. You can ask anybody that's come to me. But if you need to keep your conditioning level up and you need recovery runs, especially after a race, or if you're just feeling it more sore than normal, or you're getting a little overtraining going, and you're having a hard time recovering, getting on this, and it does, your metabolic activity, your VO2, okay, heart rate, all that kind of stuff will be the same. Okay, they've done some good studies. After you get past 20%, obviously it's going to start to change. Now, the biggest thing is we can get you back running quicker, safer, from a rehab standpoint. So I can get somebody on the treadmill without compromising the tissue, okay, and I can allow their, which we've talked about before, proprioceptors and stuff like that, to start firing appropriately without the ground reaction forces. So the ground reaction forces, the gravity in your body weight against the ground are what causes the most problem, okay? It's not the turnover in the running, okay? And so if I can take some of that off and allow you to absorb shock better, then that's going to enable you to recover quicker, to be able to get back to running quicker without compromising any kind of, you know, whether you have IT band syndrome, patella tendonitis, plantar fasciitis, you're recovering from surgery, whatever. The other cool thing is we also, anybody who's been into the clinic and been treated by any of our therapists, we definitely, because endurance athletes stay in one plane of motion 100% of the time, we work a lot of triplane motion, right? So we're trying to develop symmetry and work on your impairments. There's new shorts that have come out that allow us to do that same thing on this. We can turn you. We can have you do some lateral stuff, okay? And that's really cool. And they're supposed to be shipping me a pair of those. I'm supposed to get them next week, so they say. So anyways, go ahead, Melanie, if you want to go. So she's going to just turn it on. Now, it's going to blow up. She's got to keep her feet flat. Based on what you're coming for, I can raise or lower this. Okay? To either take more pressure off. If you have a lot of stability issues, I can bring that up and it'll help stabilize you a little bit. Now she's feeling like it's probably lifting you up now. Once this happens, it'll go down and she'll be at 100% of her body. stability, and then we'll start taking on some body weight. Do you have any pain or anything? Sorry. Bill Marks is the reason he was supposed to demonstrate, but then he went out of town. So at this point, once we start taking on body weight, you're running on a regular treadmill. You can incline, speed, whatever you want to do, you can change just like you would normally on a treadmill. It's just now we have the variable of the body weight. So I'll use Bill's example because he won't care. Bill came off of a meniscectomy. Basically, he was having trouble. He's a big guy. People with long limbs and they're big like that, like Bill is, really strong, are going to have trouble with the ground reaction forces. I don't care how strong he's getting as we rehab. It's a different, trying to absorb shock is totally different for him. This gave us the ability to go down to about 60% body weight. He's able to run and absorb shock, okay, and start to allow that tissue to adapt to that change safely. Every time he comes in, we put on different variables. So I may go up 5% of his body weight. I may add 5% of his body weight back. I may do that for 10 minutes and then let it go back down for 20 minutes, or so on and so forth. So it depends on what our goals are. If somebody's coming in and they have like an IT band syndrome, or they have some kind of irritation to their knee, I can say, all right, let's get on here and go to 9, just take 10% off. Are you pain-free there? Yeah, then run. We just take them to whatever area they're pain-free. Thank you. Does that feel weird? We can use a camera to video gait analysis. I'll be honest with you, from my standpoint, when I do a video on gait analysis, I need to see the whole body. So that aspect of things only really gives me from the knee down. I can barely see the hips. You really got to be able to see the hips and thoracic spine. So she's taking 40% of her body weight off. Feel weird? Usually you keep this, if you're familiar with your greater trochanters, if you poke right here, that little bony prominence you feel is your greater trochanter. You want this bar height to be around there. Now, depending on different goals, I may lower that a little bit, because you definitely don't want to affect the runner's arm swing. Okay, so the higher you get, then their arm swing gets kind of jacked up. Different issues or pathologies or conditions may require the bar to come up a little bit more. But generally, those aren't going to be healthy runners. Runners, again, like I said, primarily it would be a good rehab tool, return to run, return to sport, so on and so forth. But you can work a lot of overspeed training in this. Okay, you can work tempo in this. I have a lady right now, she doesn't have any pain or pathology. She's working her tempo, trying to work her turnover, her cadence. There's a lot of things you can do without overtraining or putting too many miles on your body. Like I said, from that ground reaction force standpoint. People who are wanting to go from, say they are trying to get into more of a minimalist shoe, okay, and they're used to a 12mm drop shoe, and they want to go to a 4mm drop without getting stress fractures and everything else I get to treat because they decide to do that like this, they can come in, and it's a good way to build up quicker because we can take some of the body weight off and allow them to start getting their body ready to take that shot. Well, you've gone down a lot. Now she's running in space. On the moon. Any questions on that? Okay, so this isn't giving you any resistance other than what the treadmill is giving you from an anterior posterior lateral plane movement, right? So in water, you've got circumferential buoyancy, but you're not going to be able to maintain your cadence. You can maintain your pace in the water. You're going to maintain on this, like you maintain outside. You see what I mean? Unless you can come. I mean, if you want me to come watch, you're not going to be able to maintain that same pace. So that tissue is adapting to what you're giving it in the water. You see what I mean? So there's receptors that are built into all of our tissue that respond to all kinds of different forces, including acceleration, deceleration, speed, those kind of things. So if you're not able to, if you're running in a water, yeah, you're not taking as much force from this, but you're also not getting the same turnover. You've got to be able to replicate that out in training in order for you not to cause a hamstring. For instance, hamstring training, that is more of a turnover problem, much more of a speed problem. Does that make sense now what I'm saying? So that's where this would be different than water. I still like people to train in water, and I reject people in water as far as I get them to do it. But this does give a different type. This allows you to do different things than if you're on an underwater treadmill or something.
Can you look up the courses and then watch them and then have the treadmill go up and down?
So what you can do now, obviously Alter G is going to charge you for everything, but for the Pro version, okay, not this version, you can do a USB, which we've looked into a Pro version for our Highlands clinic. We'll just kind of wait and see what happens with that. But you can hook a USB into here. Whatever parameters that we put in,